why you should start a healthcare business, and how to know which one is right for you. Imagine this. As industries across the world faced unprecedented declines, the healthcare industry in the US actually grew by over $200 billion in 2022 alone. While tech startups and brick and mortar businesses were grappling with shutdowns, healthcare businesses not only survived, they thrived. Now, here's the controversial part. Most people believe that starting a healthcare business requires an expensive medical degree or extensive training. Wrong. Whether you're a caregiver, entrepreneur, or someone looking for a meaningful and profitable career shift, the U.S. healthcare market is packed with opportunities, and you don't have to be a doctor to tap into it. In this video, we'll walk you through why starting a healthcare or medical business in 2024 is a brilliant move, and how to figure out which specific type of healthcare business is the right fit for you. We'll use real-life examples, expert opinions, and some surprising stats to help you determine the best route. Don't worry, all the links to valuable resources will be included below. Before we dive in, don't forget to subscribe to the Medical CEO Academy YouTube channel, where we cover everything from business setup to scaling your healthcare business like a pro. First, let's answer the question, why start a healthcare or medical business? The healthcare industry is massive and growing, with a global market size projected to hit $11.9 trillion by 2027. It's one of the safest and most lucrative sectors to invest your time and energy into. But it's not just the numbers that make healthcare an attractive option for entrepreneurs. It's also the stability, demand, and rewarding impact of the work. Let's break this down. 1. Booming demand across the U.S. The aging U.S. population, particularly baby boomers, has created an explosion in demand for healthcare services. In fact, the U.S. Bureau of Labor Statistics projects that the healthcare sector will grow 13% by 2031, adding more than 2 million new jobs. 2. The pandemic's lasting impact. COVID-19 changed healthcare forever. The pandemic accelerated innovation in telemedicine, home healthcare, and remote caregiving services, while also highlighting the importance of medical billing, staffing, and testing services. Entrepreneurs who entered the industry during or after the pandemic have already seen exponential growth in these niches. 3. Recession-proof industry. Unlike many other industries that ebb and flow with the economy, healthcare is considered recession-proof. People will always need medical care, and the demand for services like caregiving, telehealth, and mental health support continues to increase, even during economic downturns. 4. Variety of entry points. Healthcare is diverse, from staffing agencies to medical billing, from launching a home healthcare business to selling durable medical equipment or DME. There's no shortage of options. You don't need to be a doctor to start a healthcare business. Many entrepreneurs have built successful healthcare companies with little to no clinical background. How to choose the right healthcare business for you? Now that we've established the why, let's figure out which healthcare business is right for you. Here are a few questions you should consider. 1. What skills do you have? If you're a great organizer, you might excel at running a healthcare staffing agency. These agencies are booming right now, especially for registered nurses and nursing aides. According to the American Staffing Association, 68% of healthcare facilities rely on staffing agencies to meet their personnel needs. If you're more tech-savvy, consider launching a telemedicine company. The telehealth market, valued at $90 billion in 2021, is projected to grow by over 24% each year. And guess what? You don't need to be a healthcare provider to run one. You just need to know how to manage the operations. If you're a natural caregiver, perhaps you should explore the home healthcare industry. The demand for home health aides is projected to grow 33% by 2030, with thousands of new opportunities for businesses that can deliver quality care in people's homes. 2. How much can you invest? If you're working with a small budget, you don't need to open a hospital or clinic to get started. Some of the most cost-effective healthcare businesses to start are medical billing or healthcare consulting. Medical billing companies, for instance, require minimal equipment and can even be run from home. On the other hand, if you're looking to invest in something bigger, opening a long-term care facility or assisted living home can generate large returns. These facilities require higher upfront costs, but typically yield steady income over time due to consistent demand. 3. Are you comfortable with regulation? Healthcare is heavily regulated, but not all businesses face the same level of scrutiny. If you're worried about navigating complex regulations, you may want to avoid high-liability industries like opening a nursing home or starting a hospital. Lower regulation options include medical billing, home health care, and consulting, all of which have fewer legal hurdles. Here are the best healthcare business ideas you can start in 2024. With the right skills and mindset, you can turn your healthcare business idea into a profitable venture. Here are 5 healthcare business ideas that are poised for growth in 2024. 1. Healthcare staffing agency. A healthcare staffing agency connects healthcare facilities with nurses, physicians, therapists, and aides. The demand for staffing agencies skyrocketed during the pandemic, and it shows no signs of slowing down. Staffing agencies are particularly in demand in states like California, Texas, and Florida, where large populations and aging residents create high demand for temporary and permanent healthcare workers. Profit margins in the staffing industry can range between 20 to 40%, making this a highly lucrative business model. In a recent healthcare forum, one user shared how they started a nurse staffing agency with just a few $1,000s, building their network through LinkedIn and healthcare job boards. In just a year, they went from working out of their living room to partnering with major hospitals in their state. I never thought this was possible without a clinical background, but networking is everything, they said. 2. Telemedicine company. Telemedicine is revolutionizing healthcare by allowing providers to consult patients remotely. The beauty of telemedicine is that the overhead costs are low. You don't need to invest in a physical office or medical equipment. You just need to partner with doctors, invest in secure technology, and ensure compliance with HIPAA regulations. Since the pandemic, 76% of U.S. hospitals are now using telehealth services in some capacity, making this a golden opportunity for entrepreneurs. Fun fact, one telemedicine startup founder shared in a forum how they struggled at first to get doctors on board, but eventually won them over by streamlining appointment booking and reducing paperwork. 3. Medical billing service. Medical billing might not sound glamorous, but it's an essential service for healthcare providers. Billing errors cost the U.S. healthcare system billions of dollars each year, and providers are always in need of experts who can help them navigate the complexities of coding, billing, and collections. The best part? You can run this business from home with just a computer and an understanding of the billing process. According to one expert, medical billing is one of the most recession-proof businesses out there. As long as there are doctors, there will always be a need for billing services. 4. Home healthcare agency. Home healthcare services, which provide in-home care for elderly or disabled individuals, are in high demand as the U.S. population ages. With an aging baby boomer generation, 24% of Americans over the age of 65 are expected to need some form of home care by 2030. This is a highly rewarding business that combines healthcare with compassion. Starting a home healthcare agency can cost as little as $10,000 if you start small. 5. Durable medical equipment, DME, supply. DMEs include products like wheelchairs, walkers, and oxygen tanks. Given the increasing number of elderly individuals and people with chronic conditions, the demand for DMEs is only going to rise. What makes this business appealing is that you don't need a clinical background to sell these items. You just need to know the regulations around equipment distribution. One forum user said they started their DME business in a small warehouse and began making profits within 6 months by networking with hospitals and care facilities. Common problems and how to solve them. 1. Navigating regulations. Healthcare businesses, particularly those involving direct patient care, are subject to a host of regulations at both the state and federal levels. This can be daunting, but solutions include consulting with healthcare legal experts and thoroughly researching the regulations that apply to your specific niche. 2. Finding clients. Whether you're running a staffing agency or a home healthcare service, finding your first few clients can be challenging. Networking with healthcare providers, offering free consultations, and tapping into local healthcare communities can help. LinkedIn and healthcare job boards are invaluable tools for finding potential clients and partners. 3. Managing costs. Healthcare businesses often require upfront investments for staff, equipment, and technology. Keeping initial costs low by starting small and scaling as you gain clients is key. Utilize low-cost marketing methods such as content marketing, social media, and SEO to keep expenses manageable. Starting a healthcare or medical business in the U.S. is not only profitable, but also provides a meaningful way to contribute to society. Whether you choose to launch a telemedicine service, a healthcare staffing agency, or a medical billing company, there's a vast array of opportunities that don't require a medical degree. The key is to align your skills, interests, and budget with the right business model, and most importantly, understand the demand in your local market. If this video inspired you to start your own healthcare business, don't forget to subscribe to the Medical CEO Academy for more expert insights on how to build, grow, and scale your healthcare business. We've got all the resources you need in the links below. See you in the next video.